Well, more women are coming to the field. That's what I've noticed.
Coming into the field.
I mean, the number of women, losing is about the same, but we get more and more women every week coming in who want to get a transplant procedure.
Okay, now, in Abreu, in your case, what was your reason for your transplant? Genetics?
I had gone through brain cancer treatment.
Okay.
I had brain cancer, and the treatment lasted for 2.5 years.
Chemotherapy
I
and
had
radiation?
2 brain surgeries and radiation therapy and chemotherapy, 3 different types of chemotherapy.
Wow, that's intense.
So during the radiation and chemotherapy, I lost a lot of my hair. And I waited for a year for them to come back naturally, and it didn't. So I started looking at my options, and one of the options was Dr. Armani's follicular unit extraction.
Okay, now in Abreu's case, where was her hair lost? Was it at a certain place or all over, or how?
Well, she had 2 things. One is that she does have a genetic history of hair loss as well.
Okay.
And that was complicated by, brain surgery. And so she has scarring, obviously, from the brain surgery.
Okay.
So the first focus was to also cover that scarring, plus replace the hair that she's lost. Women, you have to be more careful in the sense because you're always transplanting in between hair. And so many clinics don't address the woman's issue because when you're transplanting in between hair, you can cause trauma to the surrounding hair.
I don't know what you mean by in between hair.
For example, women are never completely bald. Like men are often completely bald, so it's easy to transplant the men.
So it's
but
like,
women have hair, so you have to go in between their hair and
it.
also do a much better design because you have to angle each hair the way the current hair is angled.
Right.
So this requires a greater artistic skill plus a better technology.
Now also I heard that you can do eyelashes and eyebrows, is that right?
Yes, I mean this is a major growing field for eyebrows and eyelashes. It's a new trend and I think it's going to expand considerably in the next few years. And also many women come to the transplant because they've had facelifts.
Right.
So they have facelift scars, and they can be in variable areas. They can be, behind the ear. They can be in the frontal area.
They want to hide it.
And then, we want to cover up those.
Okay. So in Abreu's case, how is she going to heal, and when is the hair actually going to grow back in?
Well, we've just done the transplant, so we have to wait about 3 months for the hair to begin to grow.
Okay.
And after 3 months, it continues growing up to a whole year.
Up to so about a year for her hair to start.
6 months, you get about 50%, so she'll see the form at 6 months.
Yeah.
And at 12 months, you'll see the thickness come in.
Okay.